what would your advice be regarding having breast surgery before having children? Breast surgery before having children. Yeah, we saw someone in the clinic the other day who'd had a breast augmentation 10 years ago. She came with a friend or relative, anyway, she had a small child. She just had a baby, and so when someone has had a baby, if you've got breast implants in and you're thinking of getting pregnant, or you've just had a child, or you have children, that's it. No problem. Fine. Carry on. See what happens. Don't worry about it. No problem at all. No problem breastfeeding. No problem having children, etc., etc. There's absolutely no problem. If you've already got breast implants in and you're thinking of having children, that's absolutely fine. So the questions come, or the advice comes, for someone who's thinking of having implants, who's also thinking of having children. So if you haven't had the implants yet, well, then there's a discussion to be had, because the implants will measure you up, and we'll get the right implant for your breast shape. Now, the problem is, if you then go on and have children, your breasts can change. And the problem that we've got is it's unpredictable what happens to your breast if you have children. Sometimes, well, they always get bigger because you get milk coming in. Sometimes they stay bigger. Sometimes when you stop breastfeeding, they get smaller, and sometimes they go smaller than what they were before. And sometimes, because they get bigger and smaller, they can droop. So the shape can change. So all these things can happen to the breasts. So ideally, in an ideal situation, if you're thinking of having children, which is going to potentially change the size and shape of your breasts, you would do that first, so that when we look at when we're putting implants in, we can put the right implant in that would complement your breast shape and size at the time. If you're having surgery now, we will be working on the size and shape of your breasts now, which might be different later on once you've had children. As I say, if you've already got implants in, don't worry about it. But as I say, your breast might change. It might droop. It might get bigger. They might get smaller. So ideally, you would have the finish your family and avoid weight fluctuations for exactly the same reason. Weight fluctuations can make your breast bigger, and then when you lose weight, they make them smaller and they can droop. So do these things prior to having breast implants, because when we put the breast implants in, we will measure you and assess you based on your current size and shape of breast to try and get the perfect implant for you. Now, if we do that, and then you go on and have weight fluctuations or have children, there it might not be quite so perfect, and your breasts might droop a bit. They might get bigger and smaller, and that'll be a bit of a nuisance if you spent all this money on implants and get your breast perfect, and then that can kind of mess things up a bit, to be honest with you. But as I say, if you've already got breast implants in, don't worry about it. But if you are imminently, or if you are thinking of having children, it is usually best to wait until you've finished your family, if you can. Now, you might say there's many years, and I don't care, and I'm going to take the hit, and if it goes bad, it goes bad. If they don't look right, I'll address that bridge when I come to it. Absolutely fine, no problem at all. We're not going to say we're not going to do surgery if you think of having children. It's absolutely fine. But you have to take it on the chin that if you did have children in the future, that might change things. But as I say, some people say, well, I might not. I don't know. It might take many years, and I want to have implants now. They're like, oh well, if you've thought about it and that's the way you want to go, you can go that way. But as I say, the advice is to wait until you have finished your family. And that is the advice.